the buttocks tend to be a little bit lazy, whereas the hamstrings and the lumbar extensors, the lower back muscles, tend to be a little overactive. So in order to wake up your buttocks, get them up, give them an espresso and a slap across the face, we need to do the Buttocks Extravaganza. So the first thing is learning to stabilize your pelvis. Block between the knees, pelvis in neutral, straighten the right leg, and learn to keep the pelvis nice and still. So what you'll see often in students or in yourself is clunk, and there's a listing to the side. And then straightening the left leg. I use my fingers on my pelvis to monitor whether they're staying still. Using the deep pelvic floor muscles, not too much contraction, but you learn after a few repetitions how to control the pelvis, how to keep it steady for the movement. So once they've got that organized, bringing the heels in a little bit and coming up on an inhale to a bridge pose. Don't have to get too high, down on an exhale. And I like to do this 2 or 3 times just to warm the spine. Up on an inhale, finding that opening, making sure there's no pain in the knees or the back. Back on an exhale. And then this time we'll come up and stay up. And I don't want to go into the highest back bend. What I'm looking for in students is that I don't get these rib poppers. Those people are overusing their lower back muscles. So I'm going to bring their lower ribs in, bring their abdomen in, and even tuck the tailbone slightly to turn off those muscles and to turn on the abdomen. That puts my buttocks in action. Some people whose hamstrings are overactive, you need to push the floor away with the feet, activating the quads, switching off the hamstrings. Then, keeping steady, and I often use my thumbs either side of my pelvis, straightening the right knee, my left buttock is switched on, bending, straightening the right knee, the left buttock working. And continuing like that, they can stay for a while, they can tuck their tailbone a little bit, or for students where it's very difficult or there's sacro-iliac dysfunction, even just thinking about lifting that foot slightly off the floor or sliding it slightly away is enough. When they're finished, coming down through, removing the block, and it's lovely then to go back up into a bridge with feet hip width apart and feel how when you switched on your buttocks, it really helps you open through the pelvis. At the top of the bridge, the buttocks can ease off a tiny bit as we get that sacral nutation. And then we've got an even democracy of muscles, lower back, buttocks, hamstrings, working to create this strengthening back bend. Coming down. Some people like to lie flat out and open, and others take the knees to the chest.